COVID-19, we've all heard of it, the infectious virus that shut the world down. I'm sure each one of us can share a key moment or memory from those years that shaped our career as nurses. As of November 2021, the Lancet Regional Health Western Pacific discovered over 2,000 nurses quit their professions due to the burnout and staffing shortages in Australia. But is COVID-19 really the reason for the rapid decline in healthcare? Good afternoon, my name is Kayla MacDonald, and I would like to explore with you the impact COVID-19 had on the nursing profession. Did nurses experience more burnout during this period? And if so, what were the contributing factors to this burnout? And what are some interventions we can put in place to improve the future? The article Burnout, Stress and Resilience of an Australian Regional Hospital conducted a longitudinal study during COVID-19 on what contributed to their staff's burnout and stress rate so they could establish plans for potential future pandemics. Specific questions were asked within the study identifying key components on what contributed to the decline of mental health in nurses, thus increasing stress, which resulted in nurses abandoning their career. The exodus of nurses caused staff shortages, resulting in overworking their current staff members. To conduct this, questions were targeted towards finding out the relationship between burnout versus resilience and stress versus resilience, and how age and nursing roles contribute to it. Due to the research being conducted in a regional hospital, the data collected was specifically about a regional hospital and not focused Australia-wide. By this I mean further research should be conducted on stress and burnout, as it can have an ongoing impact on an individual's life. In saying that, any qualified nurse can take away further knowledge and understanding through this research so they can see how they can apply it to their own clinical practice and personal home life. The decline of Australian nurses within healthcare was already prevalent before COVID-19, which presents us with the question if COVID-19 was really the reason for the rapid decrease in staff, or if COVID-19 increased resilience within healthcare. In fact, research showed that between August to November 2021, during the COVID pandemic, they recorded each staff member's well-being using a scale with 2.0 low to 2.0 high. Increasingly, it was discovered that there was a small increase of stress to 2.5, but there was also a rise in resilience to 3.5. What was discovered that burnout actually increased between August and September to 3.6, but then it began to go down again through to March 2022. However, during the time lockdowns were in effect, stress remained constant. Even though we can see the statistical data that there was a large amount of burnout, as nurses, their resilience increased. In fact, the research in the article showed resilience remained across all staff members, regardless of their workload, and in many instances, burnout heightened after the pandemic, not during. People often think that nurses were overworked and that this was what led to burnout and what led to less resilience. Correlational analysis shows that this isn't right. The workloads seem to be distributed evenly between staff. The analysis of variance showed through its data that both workload and resilience shows variance, but the overall result does not have a massive impact, leading one to surmise that maybe something else contributed, and so more research is warranted. The Nursing and Midwifery Board of Australia outlines standards on how we as nurses should uphold ourselves in the healthcare setting. Considering we all know the feeling of exhaustion and fatigue that comes with the role as nurses, what can we learn from this research, and how can we enhance our patient care for us and ourselves and patients? As a patient, resilience is vital. However, research shows that fatigue and burnout can lead to making critical mistakes, which can endanger our patients' lives. Due to the high levels of fatigue, stress, burnout, and lack of resilience, this research promotes the importance of mental health and self-care while educating healthcare facilities on how to cater and provide further support for each nurse. It's important to note that also the Nursing and Midwifery Board standards provide an outline on how we conduct ourselves as nurses. Mental health awareness and boundaries should be implemented for the well-being of staff and the protection of patients as a result from the studies conducted during COVID-19. Robin, I'm going to pick on you for a second. Imagine you are working during COVID-19. Your 2 kids can't attend school due to lockdown, so they are doing online learning. You have been called for a 9 p.m. start due to understaffing and you've been wrestling with their schoolwork all day, you are physically and mentally drained. Would you truly feel capable or confident to complete a 12-hour overnight shift safely under these conditions? Probably not. We must remember that this was a reality many nurses had to face. There was a study done on how COVID-19 affected different age groups of nurses within healthcare. It was identified that between August 2021 to March 2022, healthcare workers aged between 26 to 30 experienced burnout quicker than older staff. This effect was highlighted more if the nurses worked part-time and during lockdown, probably due to family responsibilities, school shutdowns, and lack of childcare. This information is vital for the future. This helps us tailor support for staff in the future, particularly during a crisis. Although this article displays excellent longitudinal statistics, there is a limitation of evidence due to the findings being limited to a single regional hospital, rather than Australia as a whole. This unfortunately can hinder its applicability due to the fact that there are different policies and hospital management systems in other states across Australia. Therefore, it is necessary to conduct further research across other diverse healthcare settings to truly conclude whether COVID-19 was the primary cause of so many nurses leaving the profession. Evidence provides an understanding that COVID-19 contributed to its rapid rates of burnout within healthcare due to exhaustion. This is proven by the increased burnout rates during December 2021 once lockdown ceased. Although evidence points in the direction that the exhaustion caused by the staff, resilience could have contributed to the spike in burnout. It remains hypothetical. The study has, however, provided an opportunity to reflect. It offers evidence-based understanding on how burnout, stress, and resilience can have an effect on the performance of a nurse. It also brings to light there is a need for specifically designed support systems to identify age, workloads, and working hours. Whether we are going through a crisis or not, this research highlights the need to prioritize a nurse's mental health in order to provide self-care and great patient-centered care. So does this data show that burnout in nurses was caused by the pandemic? Ultimately, more evidence is necessary, as the data does not definitely prove the increase in burnout was caused by the resilience of nurses or the pandemic. Pandemic or not, this research only enhances patient-centered care and increases well-being among patients and staff. The truth is, healthcare workers are physically and emotionally exhausted, and it's becoming harder to find people with the energy and the passion to get involved, whether it be in professional development or research or available for taking shifts in the healthcare system. But what we do know is that the passion and the evidence it creates can be a game changer, not for nurses, but for their patients too. It would be good to acknowledge that we can do something by looking further into evidence-based research and what we can do to prevent burnout in our workplace, to look for ways to support those around us, patients and colleagues, and to identify that COVID-19 wasn't the only factor leading to burnout, so we need to move forward and explore other reasons behind potential nursing burnout. Thank you.